Good afternoon. My name is Virgil Stucker, and welcome to a webcast called Food for Thought. We're having conversations with mental health leaders. Today we have Tom Starling with us, and I'm going to give you more information about Tom in a couple of minutes. Hello there, Tom.
Hello, I hope you're having a good morning/afternoon.
Oh, yes. Thank you so much, Tom, for joining us. I want to acknowledge Stephanie McMahon, who's behind the scenes on this. She's my colleague in what we're doing and the executive producer of our webcast. So thank you, Stephanie. Today with Tom, we're going to talk about national advocacy organizations and how they can provide support to parents and professionals and people who are challenged by mental health issues. In thinking about this morning, I was thinking about the spectrum of need that sometimes comes to us. Like this morning, I had a call from a grandmother who was worried about her 17-year-old grandson, Tom, because she was seeing some signs of mental illness and wondering if she could prevent things getting worse. And then I had another call from two parents worried about emerging psychosis with their son. And then yesterday and this afternoon, two separate calls with parents with children who are now, middle-aged adults focusing on their long-term needs with schizophrenia. So as we both know, Tom, the spectrum of mental illness sort of is pretty broad and also can go across a lifetime. And sometimes people can feel pretty alone in dealing with this process. So part of our conversation today is, I think, how these national organizations like Mental Health America, which you chair, and NAMI and some others, and you'll get into looking at the details of those. So hopefully some of the families and professionals who are attending will get some new ideas and learn how they can connect with some of these organizations. Tom, I'd like to talk a minute about you, if I can. Again, these are conversations with mental health leaders, and we're so honored to have you with us, Tom, in this process. You are the president and CEO of the Middle Tennessee Mental Health Association, and also the chairman of the board of the entire Mental Health America organization. Originally from Texas, where I actually also sort of started out, but that's another topic. So 26 years ago, you got your master's in divinity, which I've always thought is a great background for a mental health leader.
Sure.
And also added a master's in medical ethics and a doctorate in education administration. Goodness, Tom, you've been recognized by 6 consecutive years as one of Nashville's in-charge health leaders, selected as a healthcare hero by Nashville Business Journal. That was 2012. Also designated as one of the most admired CEOs in the Nashville area, and a Supreme Court mediator. Well, that must be interesting, since 2007. In addition to your current CEO role with MHA in Tennessee, I know that you've also been a CEO of an Alzheimer's group, as well as a United Way, a university administrator, and a hospital chaplain. Sounds like leadership is really a part of who you are, Tom.
Well, that's nice. Yeah, they say a truly great speaker needs no introduction, so just keep going.
Okay. Well, Tom, and goodness, it goes all the way back to your youth when you were an Eagle Scout. I know you live with your family in Tennessee, and last time you and I had a chance to talk like this, we were across the table in a restaurant, and I just, I cherish so much mental health leaders, people like you who are willing to help make a difference in the lives of very vulnerable people. Can you tell us a little bit about why you've become the leader that you are? Why did you sort of take this path before we get into the national organization groups?
Sure. Well, and first of all, thank you, and thanks, Stephanie, for inviting me to be part of this. I think advocacy is so important, and if it's one thing that I've learned in this role is you don't need to do life alone. So to partner up with these groups and learn to volunteer or serve as a board member or be part of something strong that's already going on, there's no need to start from scratch when you have such great backbones to rely on. But as for me, it's funny how I got into this, because I started off as a chaplain at a children's hospital, and then was a college minister, and worked for colleges and universities, and then worked with the elderly as a long-term care administrator, and then with the Alzheimer's Association. So of course my parents thought next, well, he's going to be a mortician, because it just kept getting older and older. But fortunately, I ended up with Mental Health America. And I tell you, Virgil, from the womb to the tomb, there really is no health without mental health. And my background is a chaplain and working with young adults and babies in hospitals. That's one thing that I've really learned, that living is not just being alive, but it's being well. And that's something that we all seek.
Okay. Well, thank you again, Tom. I'm aware that in our field, in our mental healthcare field, it's really difficult to get strong and positive leaders like you. So thank you so much for what you're doing. Let's move to some of the talking points for this conversation. Always like to sort of leave people with maybe 3 new ways of looking at things, or adding information or questions sometimes. So we're going to turn to you in a moment to sort of understand a little bit more about some of the national advocacy groups, Mental Health America, NAMI, others. Secondly, try to understand how their missions and what they do can impact families and professionals and help in the overall planning and implementation of mental health care. And then thirdly, you and I were also concerned about how do we reach rural America that may be somewhat at a distance and even more alone than some of those in the urban setting. So let's start for a moment on the advocacy groups that exist, looking at what they do, what their differences are, how they exist across the spectrum. Can you go over some of those for us, Tom?
Sure. And, there's always some ebb and flow. I think a lot about how organizations start off, and as progress is made, they might change gears. You look at something like March of Dimes, and once polio was kind of had a handle on that, they went into other birth defects. So I think it was polio. But times change and organizations change, and some of these organizations have been around for quite a while. So of course, just being selfish and being able to think off the top of my head about MHA, Mental Health America, many probably still know it as Mental Health Association. That's what it was for about 100 years. And at their centennial celebration, they actually changed their name. They rebranded it to Mental Health America. And there's about 200 of those affiliates, with the headquarters being in Alexandria, Virginia, just outside DC. And I tell you, I'm a proud affiliate director of MHA. I always tell people Mental Health America is like the United Way of mental health. They try to do what that community really needs. Most of them don't provide direct services like counseling or respite. They're Switzerland. They just kind of they're that neutral convener that brings together meaningful groups to really advocate for housing and better information and referral, screenings, educating providers, families, youth, soldiers. So each MHA is a little different. There are some that have 200 employees and are quasi-governmental. Most of them have 3 to 5 employees, and they do a lot of that advocacy and helping families navigate the system and point them in the right direction. If you go to the National Mental Health America website, one of the things that I like is that they have 10 free anonymous screenings And at mentalhealthamerica.net, you'll find these screenings. They're all evidence-based. I tell providers, you should put that link on your website. And that way, when people come to your site, they can take a screening and still be able to be on your site to make an appointment. So it's a really great resource. But they do a lot of advocacy. They were the ones who kind of invented May as Mental Health Month. And so there's always a lot of really good information. And
that resource you just mentioned, Tom, an anonymous way to sort of do a screening.
Yes.
So you can do that if you are worried about yourself, or you can do it about a family member. And can people get access to that screening by going to an MHA website? How does it work?
Right. The national site is mentalhealthamerica.net. Okay. And then you'll see pretty clearly on there a way to do the screenings. And they have 10 screenings from depression, bipolar, trauma, workplace wellness. I take that one every Monday morning. They have really great evidence-based screenings, and you could print those out and take them to your therapist, or be able to track yourself maybe month to month, and being evidence-based. It's not a Cosmopolitan magazine type of survey. They're really good tools on those.
So almost they can go to MHA.net and they can find that.
It's actually mentalhealthamerica.net. It's a long one.
Thank you. Mentalhealthamerica.net. Great. Thank you for letting us. I didn't know about that resource. Thank you.
Sure.
Yeah, you said there are 200 chapters. Do you cover almost every state in the nation?
We don't cover every state. Some of them, they have an MHA in every county. Other states don't have anything yet. Some have one state affiliate. I know in our state of Tennessee, they have 2 affiliates. In Indiana, they have closer to 20. So it's every state's a little different.
Okay. Well, thank you. Thank you.
Yeah. So I'm going to talk a little bit now about NAMI, which is the National Alliance on Mental Illness. Every state needs a strong NAMI. I think NAMI is in every state. And they really have great NAMI-approved programs. And this might be something like NAMI Basics, where they teach families and adults who work with youth about adolescents and about young people with mental illness. And those are great programs and support groups. They also have NAMI Homefront, which is a focus on military. And one of my favorites is called NAMI Smarts. It's a great program they offer to really help people self-advocate, people with lived experience. And, when I think of NAMI, the one thing I always think about is connecting with families, connecting families with other families. What doctor worked for you? What medication didn't? Where do you go for day programs? How do you afford this or that? Sometimes it's that word of mouth and coming from another person who has that same experience that really brings a lot of comfort and understanding. And it's a real stigma-free environment when you go and get help from a NAMI affiliate. And there's probably 400 of those chapters. I don't think they're all incorporated. Every state probably has 1, 2, 3, 4 incorporated NAMI chapters. But then there's a lot of grassroots organizations in every state. So you could probably find a NAMI very close to you in order to hook up and get those materials and those support groups. And again, just that family word of mouth, which can't be beat.
Thank you for this information on NAMI. So I know of like the family to family support groups and the family education groups that they do. So what I'm hearing you describe is they're doing even more now for peers, for people with lived experience.
Yes, they are. And I think everybody is kind of moving that way with peers. I think that as we destigmatize mental illness and even substance use disorder, that more and more people are really validating the impact that peers have, whether that's individual to individual or family to family. And I tell you, it means a lot when we have a veteran that can go out and talk to another veterans group. That has a lot more impact than when you put in there a teacher or a doctor. Some people really like to know that you've walked a mile in their shoes.
Okay, that's right. Thank you. I know you're going to talk about a couple of other organizations, but let me pause for a moment for those in the audience and let them know that, if you are having questions where you wish like you could put up your hand and ask it, well, you actually can. I think over on the right side of your screen, there's like a bubble with a question mark inside of it, something like that. If you click on that, you can send in a question. And as we end up our conversation around 12:40, 45 or so, we'll go to a Q&A session. So please do submit your questions. Also, just letting you know, at the end of the conversation, there will be a slide with the websites, so with the names of the organizations we're talking about listed, to give you sort of easier way to jot that down if you wish. And also Tom's offered his email so that those who are listening to this might also be able to email you with any questions. So let's keep on going, Tom. So what are some of the places, other organizations?
A lot of times I'll direct people to DBSA, which is the Depression Bipolar Association. So especially when I think of depression, I think of DBSA being a real leader. Now, I don't think that they have as many affiliates as MHA or NAMI, but the Depression Bipolar Association, they do a really good job. If you can find a local support group for them, then you're going to have strictly a depression support group or strictly a bipolar support group. And that's really good, because a lot of times, just because of the stigma with mental illness, there might just be a general mental illness support group that comes together. Somebody with PTSD, somebody with postpartum depression, somebody with schizophrenia, maybe somebody who's a family member. But it's great when someone like DBSA can really create these needed support groups where it's just depression or just bipolar. And they're also really good at providing podcasts and webinars and some things that are right there online 24/7 that you can utilize. I've noticed they must have a lot of 8-year-olds and 10-year-olds working for them, because they have a lot of technology that you can really get into when you need it. And I think that's important.
Okay. Are you saying, Tom, that you and I are not as adept at similar technologies?
Not on this end. Not on this end. So I'm going to probably keep looking and nodding and smiling at this webinar an hour after it's over with, just to make sure.
By the way, this webinar is also recorded, so if people don't catch you in this conversation right now, they can go to our website and look at it later and send it to others later too.
That's great.
So let's keep going. DBSA, are there others?
Yeah, let me mention just two more. This next one really is not specific to mental illness, but it's a great resource if you're over age 50. And it's the Area Agency on Aging and Disabilities. We always called it the AAAD, but it's the Area Agency on Aging and Disabilities. But they're great at helping people get onto Medicaid, have meals delivered, find outings, do housekeeping chores, somebody to come into the house, maybe to just do laundry and make a week's worth of meals and put them in the freezer. The little personal devices that you can wear around your neck or wrist, and you can push the button, help, I've fallen and I can't get up. I mean, those types of calls. They're really good at helping people who are over age 50 to stay independent, stay at home, get the help they need, maintain that quality of life. They're a real gem when you can find a great area agency on aging and disability in your state. So again, they're not specific to mental illness, but they are great just for a resource for people like me who are over age 50 now.
Okay.
And then the last one I wanted to mention is one that I have not heard of, but I have heard good things about, and that is the Schizophrenia Alliance and Related Disease Association. I think they still go by the Schizophrenia Alliance sometimes, but they're a great group. You think of schizophrenia, and that's 1% of the population, but they're high utilizers and high needs, and it's just so important that this group now, I know it has probably 150 different groups that meet across the U.S. and even internationally. But for schizophrenia, again, anything you can do to connect people together and provide those types of specific resources and have that specific type of advocacy. 1% of the population does not sound like much, but think outside of your town, outside of your state, maybe even now outside of your country, and that 1% really starts building up pretty quickly. And they were started, I believe, in 85 or so in Detroit, but they've just continued to grow, and they have some really great information. The people I know with schizophrenia, schizoaffective disorder, those types of related diseases, they really work hard on behalf of Schizophrenia Alliance. And so I really want to put that out there for people to research and learn a little bit more about.
Okay, well, very good. I'm sort of seeing you paint this picture sort of across a spectrum. That was one of the words I used as we began the conversation. I mean, across the time spectrum. Mental Health America goes back to 1909, I think. Is that right? Something like that.
Right.
It's interesting sort of observing how society deals with sort of human misery. And, we name it in different sort of mental illness categories, et cetera. But how we try to take care of it as much as we can, and sometimes we're left alone. So you're showing a way that we can develop some connections to care we need. NAMI, I think NAMI started like around someone's kitchen table or something, right? Back in
they did. They have stayed strong with families ever since that, and they did. They started off with family members talking about their issues.
So they're talking about the issues, trying to find a path to solutions, not necessarily quote cure, but recovery. Trying to, early on in the path, trying to help prevent sort of serious issues that maybe in some cases can be preventable. So just thinking across that spectrum, moving down to maybe our next point about sort of the value that can be provided, about the value provided by these organizations. Think about the professionals that may be listening. It seems like it might be good if they would have these websites or brochures about each of these organizations in their offices. I mean, this sounds like it'd be really valuable to professionals. How can they benefit from making sure their clients know about these organizations?
I think it's a great resource. If you're seeing everybody, your clients once a week or once a month, what are they going to be doing for the rest of that time frame? Hopefully doing a little journaling. But wouldn't it be great if they could get involved and say, one of the founders, actually the founder of MHA, his name was Clifford Beers. He wrote a book called A Mind That Found Itself. And one of the best quotes in that book, he says, "I must fight out in the open." And, to be able to get in the ring with a group like MHA or NAMI or DBSA or Schizophrenia Alliance, I think any of that would be so worthwhile to say, hey, I'll serve as a board member, or I'll raise money for you, or let me have some of these materials. The materials that they have from their medical directors, their advocacy components, from each of these, you could probably fill your practice offices with information about depression in the elderly, teen self-esteem, schizophrenia, PTSD, adverse childhood experiences. But just to be able to get online and say, hey, send me, 25 of each or 50 of each. And let me be able to connect my clients to these affiliates and to these chapters, because you don't want to just sit at home and wait for the therapy to work, or the medication to work, or the meditation to work. You want to get out there and work. You want to get out there and reduce the stigma and teach and show others about your story that you have. And these groups can teach you to advocate, to self-advocate, to share your story to legislators, mayors, funders, and all of that's important. But I think that practitioners especially could utilize a lot of this information in their offices for their clients.
I can't see any downside. I mean, none of these organizations are providing therapy or psychiatry. They're not doing licensed professional work. I mean, I can't see any downside as far as a professional offering a link. Can you?
No. I will say, there are some of the affiliates do, some of the larger ones might do housing or counseling, but most of them are doing peer support and support groups and maybe something like case management, but really even that, they really try to connect you to resources that exist in the community. And wow, what a mistake it would be to think that you as a social worker or a psychiatrist or a family member, that you would just have to start from scratch to create something when you might have something very powerful right there in your backyard that's existed for decades, that you could hop onto and make even a more powerful difference.
Okay. And thank you, by the way, professionals who are listening and taking all of this in. Thinking about the impact on families. So let's do a real-time question from a family member and see how we might help this person with her question, if one of these groups might be helpful. So she says, my 28-year-old son is at a rehab center for mental health and dual diagnosis. He was doing very well, but started exhibiting psychotic symptoms again. They forced him to take medications, but they would not let me talk to his doctor, psychiatrist. He did sign a release, though, so they should have been able to talk to me. All my communication is only through his therapist or a program director. Is it normal? Or do I have the right to insist on talking to the doctor who prescribes the medications? So I'm not saying that we necessarily are going to give that direct answer to that, but can a mother like this call, or a father like this call an MHA office or a NAMI office and get some help with a question like this?
That would actually be perfect. I think all of us know of different groups like, every group every state has a protection and advocacy center that has social workers and attorneys available to help guide families, whether it's a special education need, a hospital need, a jail need. We might also make referrals to like a recovery court and really work on trying to get somebody maybe, instead of through the regular court system, go through a drug court or a mental health court or a veterans court. So there's, just knowing the resources in the state and how you might work with universities and attorneys and courts and hospital associations and physician groups. That's exactly what NAMI, MHA, DBSA. That's what these affiliates do, is help you navigate a very confusing system, frankly.
So thank you for that, Tom, and I hope that helps the listener with the question they have. I would observe that, I guess, with the release, generally that means the family member can get information if their family member has signed. And it sounds like this person is able to get access to information through the therapist of their family member. I know that sometimes psychiatrists are so pressed for time that they might like for communication to go through the therapist. So I know that that's often a practice, but doesn't mean that the psychiatrist would not share the information. It just might not be as efficient as a direct relationship with the psychiatrist. So, well, thank you. That's sort of in the moment, Tom, from a listener. So, I started out thinking about like this grandmother who called me this morning about her 17-year-old grandson who's dealing with, it looks like, some mental health issues. He divulged that he was smoking some marijuana, having some, he's worried. He's open enough to share that with his grandmother, maybe not with his parents. So that grandmother's wondering, how can I make sure he's getting help? Who would she go to? Would she go to MHA, NAMI? How could she get some advice on that?
I think just as far as information in referral, a lot of these might be very similar. I know, just to be thinking when you make a call to any of these groups, kind of help them out as to if you're talking about prevention, early intervention, maybe some type of integrated treatment to where you have mental health and physical health both being attended to, and of course recovery. If somebody's in full-blown psychosis or full addiction with a substance use disorder, to really frame your question to these groups that that's what we're looking for. Some groups might be a little better at focusing on the illness. Other groups might be a little bit better about thinking about the full continuum, prevention to recovery and social inclusion as well. So I would just say it's really how you frame those questions, and don't stop by just calling one of these organizations. Try to email or connect with at least a couple of them.
Okay. Oh, good. Let's move a little bit further along the spectrum. I'm thinking about a call I had this afternoon with some parents who have an adult child, I think mid-40s, and the parents are aging, and they've been trying to, provide the best care they could for their adult child, I think like in the garage apartment or something like that. So, their child is not yet 50, I guess, so not necessarily in the area agency of aging and disabilities category. But maybe would a family turn to that group for some long-term planning support? Because they're realizing they're not going to be around forever. And can that agency help?
They really can. That area agency on aging and disabilities, they would probably like to talk to you about power of attorney and advanced directives, maybe even setting up something like a special needs trust to make sure that when the parents are gone, that they're still monitored and managed resources for that loved one who maybe isn't good at handling financials and money. They'll talk to you about conservatorships, and many states have a conservatorship or guardianship association to where, even within those types of groups, they would know who would take on maybe a small case. Not everybody has money, but to be able to help them get the help they need and to plan ahead. If you have a financial advisor, definitely to talk to them. They know, various resources in that for-profit world. Sometimes you do get what you pay for, but not always. I tell you, when it comes to mental health care, I think many states offer better services through Medicaid than maybe what you could get through commercial insurance. There's not a lot of people that even take insurance these days, but I tell you, I have really seen some wonderful, wonderful Medicaid services. So to be able to talk with your area agency on aging about that, they would probably be more astute than a senior center or anything like that. You want to make sure that you plan ahead, especially with that the power of attorneys and those advanced directives.
Okay. And so this area agency on aging and disabilities, is this a public organization or a nonprofit separate organization?
I've always found them to be quasi-governmental, maybe tied to like a commission on aging. Some states that might be a cabinet level position, and other states it's not. But most of them are themselves a nonprofit, but they're funded by that state's commission on aging. Perhaps a lot of their money coming down through the federal organizations. But I've also seen them raise some money. So I do think that they're typically nonprofits, but mostly funded through commissions and departments that are committed to aging.
Well, they sound like a very important resource, because as I look at the aging baby boomers, and I'm in that category, and I get calls from other people in that category, they're worried about the future, what's going to happen. And I hadn't thought about turning to the area agency for them. There are attorneys that we know that are good at, long-term planning, et cetera. But this area agency sounds like a very valuable resource, Tom.
It really is. And with any of these groups, I think that if a family member or a practitioner came in and said, hey, I'd like to do an hour of continuing education on behalf of MHA that focuses on this particular issue, or I'd like to just do a after hours event for families that want to plan ahead for their loved ones who have a mental illness. I think any of those types of offers would just be gobbled up. Even if a family member called and said, I want you to utilize my story on social media, and there might be a release to sign, but story banking and providing that lived experience and providing continuing education. I mean, there are multiple ways that each of these affiliates and chapters could utilize your valued message. So please contact them.
Okay. Well, thank you. Tom, we have an active audience, and I'm being fed some questions that maybe instead of waiting until the very end, I'm trying to figure out which ones are really appropriate for now, where we're looking at how families can benefit from these organizations. So we talked a little bit about state conservatorship, or about conservatorship. And this is a listener who's looking at conservatorship in California. And actually recently I became aware of a range of public facilities in California that apparently every resident is under conservatorship. So this person asks, wonders if you have ever visited any of those facilities. And apparently this person's son is already in one. Do you know anything about that group of facilities, which I just learned about last week?
I don't. I don't know about that. And conservatorship is so important too. And like I said, I think every state probably has a conservatorship association. They probably don't meet very frequently, probably 2 meetings a year or conferences a year. But that may be something that you could call or email them for more information about how your state handles conservatorships and guardianships. But I'm not familiar with every state. California, I'm not familiar with that. I can tell you in Tennessee, they're trying to lower the age of conservatorships for the Commission on Aging. I think right now you have to be 50 or 60. They're trying to lower that to 40 because they do realize that so many of these parents are going to be aging in place and maybe passing on, and they want to make sure that they have something planned in advance for their loved ones. But I'll have to look into that, into the California system.
And is there an MHA office in California?
There's a lot. They're much larger there. California is one that has really invested a lot of funding into mental health, and so there are very large affiliates in some of those larger cities, as well as large NAMIs and DBSA and the Schizophrenia Alliance. So they're all located there, but really good affiliates.
So this person could also call their local affiliate of either MHA or NAMI and probably get some additional information.
That's right. And you could always just Google the national organization, and they'll have a little link on there to help find you that local affiliate or chapter that you could get involved with or call and ask those questions to. You'll definitely want to try to get somebody as much in your backyard as you possibly can.
Okay. One more question before we go to the third bullet point about rural America. And I know that MHA is focusing a lot of its work on prevention. So this question, I guess, is delving into what MHA and you might say would be the best recommended route for early intervention if you think there may be emerging psychosis.
Yeah, so, ever since our founding, we've really focused hard on that full continuum. But I would say to get online and take a screening. That's number one. Again, all of those screenings at mentalhealthamerica.net, they're all evidence-based screenings, whether it's bipolar, anxiety, addictions, what have you. And that will give you really great feedback that you could take to your primary care physician or to a therapist. I would also say, go ahead and just ignore that stigma, beat down the stigma, and get to a practitioner, get to a therapist, just to kind of talk about it. We're drinking with our mouths, we're smoking with our mouths, but nobody's talking with their mouths anymore. So everyone needs somebody to talk to, right? So just to be able to go and talk to a professional about that, because the big thing with Mental Health America, our mantra is before stage 4. You would never wait till stage 4 breast cancer or stage 4 kidney disease to say, oh, now I can start treatments. I've waited long enough. Now I can begin the treatments. But in our society, it's perfectly acceptable to wait until a suicide attempt or incarceration or expensive hospitalization before, they say, oh, well, we all knew something was going on, or he was just too ashamed, or the stigma is too large. We need to get help before stage 4, and the earlier you can do it, the better off you're going to be. Most people that call us, they needed help 6 or 8 weeks ago, and now they might, depending on their insurance, they might have to wait another month before they have a therapist to see. And so, we tell people call around to the universities, call around to some of the faith-based organizations, look for some sliding scales. And these are things that your NAMI and MHA affiliates can put you in touch with. But, it's far better. I mean, I know that sounds ridiculous to say, but it's far better to start early than to wait, because it could end up being a very bad chronic physical problem by the time you get help for your mental health.
Okay, so what this points out to is the importance of assessment. Some of the assessments can be anonymous, as you said, with some of the screening, which is terrific. Some of the assessments need to be deeper. What may appear to be a mental health issue could also be a physical health issue.
Right.
And so,
yeah, and, I would just encourage you've got to act. I wish I understood the stigma more. I think it's things are getting better. I think because of our athletes and our soldiers returning from war and people talking about their postpartum depression, I think more and more people are addressing mental health today more than ever. So hopefully that level of stigma that you have to kind of push up against to make yourself go, to a therapist or a professional, hopefully that's worthwhile. And they'll certainly know more than your primary care physician. I mean, if your primary care physician or even the ER doc had, half a year study in behavioral health, that would be incredible. You really need to go to a specialist to get that diagnosis and know what you might be fighting against.
Right. Thank you for that. I think we have about 10 active minutes left. We'll be heading on. So the third area that I know we wanted to talk about was rural America, which may, have families that feel even more alone. And I'm wondering what we can offer them, Tom. What can we offer them today as a way to connect?
I just want to say that when it comes to suicide prevention, when it comes to mental illnesses, the biggest protective factor is connectedness, whether it's connecting with your family support, a support group, your faith community. That connectedness means a lot. And if you're in rural America without some of these resources in your backyard, there are some options. We've mentioned the online screenings, which are great. You could take those screenings, you could provide those screenings to your community that you live in, make sure that they're known far and wide. One of the best is United Way's 211. Just like you would call 911 for a emergency, you could call 211 to get help of finding a therapist who takes Medicaid, for finding support groups in your local area. I would encourage you to look at your school counselors or your school social workers. They typically surround themselves with very like-minded people, and they would know about some resources right there in your small town that you probably don't even know about. For many of the practitioners, if there's not a NAMI or MHA in your backyard, you don't even have to get those branded materials. I would encourage you to go to NIMH, the National Institute on Mental Health. It's just like it's a section of NIH, but it's NIMH for mental health. And you can get non-branded materials in English and Spanish on depression, bipolar, suicide prevention. They'll have multiple fact sheets, brochures, booklets. You, instead of ordering 50 in a bunch, you can just print them out as you need them in English and Spanish. And while you're on there, I would even encourage you to look at some of the research trials at NIMH. You might be surprised at what's happening right there in your university. So there might be some research available. Even if that research doesn't help you, it might help future generations to not go through what you're going through. So definitely NIMH. I tell people too to always keep into their cell phone. There's now a crisis text line. We tell people in Tennessee to type TN to 741-741. You could type in MHA. You could type in Virgil's name, or you could type in help. Just as long as you type anything into 741-741, then you through this crisis text line will be immediately connected 24/7 to a trained crisis counselor. And how wonderful is that to have somebody right there?
741-741. I mean, let's say that again. So if you're in a crisis and you need some help, on your cell phone, you can type in 741-741 and you're going to hear something?
And just send that. Just text it. Text help to 741-741, hit send, and you'll start texting back and forth with a trained crisis counselor. And they're available 7 days a week, 24 hours a day. And it really is. It's great. And the youth love that resource. Virgil, when I go and talk to a classroom, I'm always confronted by at least one student in every single class who says, I need help, or my sibling needs help and my parents are too embarrassed. What do I do? And I'm like, oh, after rolling my eyes and being a little exasperated, I tell them about the crisis text line of 741-741 and to go talk to their guidance counselor about that, to be connected to, because anybody can use this text line.
That is fabulous information. Thank you for that. I know in talking about those in rural America and those who may have a mental health diagnosis and mental health medications, sometimes it may be hard to get access to medications. You had a couple of ideas you mentioned to me.
Yeah, so this is what I do, because being a nonprofit director, that automatically means I'm a cheapskate. So I'm a professional beggar, and I'm looking for the best deals out there. So I get onto one website called milligram.biz. And when I go to milligram.biz, it immediately, shows me where I can get the least expensive prescription medications that I need. The other one that I personally use is called Family Wise. It's Wise with a Z, Family Wise. But I have Blue Cross Blue Shield insurance. I have good insurance, but just having my Family Wise discount card, many of my prescriptions are cheaper through Family Wise than through my insurance. And I've had other insurance, Cigna. It's nothing about one or the other, but Family Wise is great. And you put in two pieces of information. If you're an undocumented worker, if you have, if you don't speak English, I mean, they have, it's all right there where you can sign up online on Family Wise website, and it's a great discount. And then the third one I wanted to mention, it's one called northwestpharmacy.com. And northwestpharmacy.com, it's a pharmacy that has pharmacies in Canada and internationally. And at northwestpharmacy.com, they will mail you your prescription. So what a convenience to not have to go to the pharmacy and not have to go through all that rigmarole, but to go ahead and take your prescription. I mean, you still need a prescription from your physician, but to be able to have those delivered, maybe, do a 90-day bottle of worth of prescriptions and have them send it to you. And they have really good prices. And people I've talked to have found that to be a very reliable source at northwestpharmacy.com.
Okay, great. Thank you for that. I mean, the viewers now can see the names of some of these places that we're talking about on the slide on the screen. Those who may be listening but not able to view, if you're having any trouble, getting access to the names, just email us. It also shows Tom's email of T for Tom, T Starling, STARLING at MHAMT.org. Is that right, Tom?
That's right, like Mental Health America, Middle Tennessee.org.
Okay, and so one other small question, Tom, as we finish up, and addressing you as a mental health leader with an obvious passion for this. What if you had unlimited resources available and could solve the most critically important problems in front of those who are wrestling with mental health issues? Small question, what would you do?
If I could wave a magic wand, I would encourage people to be open and honest and to be able to verbalize what they're going through. Nobody is ashamed of their cancer and high blood pressure and kidney disease. And we really need to show everybody, if 1 in 5 people annually have a diagnosable mental illness, if half of all lifetime mental illnesses begin by age 14, then, I mean, you're dealing with a huge population, and everybody goes through something in their life. So I would just really say, let's fight out in the open. Let's reduce that stigma and start talking about it, because truly there is no health without mental health. So there's nothing to be ashamed of or scared about. And there's resources like these that are out there. Just to mention these few in a short time frame, there's even more. So hopefully people will be emailing me, Virgil, and showing me some of these that I've left off as well.
That's great. Yes. All right. Yeah. Listeners, please email us with any other thoughts. And also, some of your conversation, Tom, brings up ideas for future webcasts. In fact, the one comment you made about insurance coverage, some people don't take it, who takes it for what, Medicaid, et cetera. Our next webcast is going to be with Scott Leshen, who's the president of a group called SJ Health Insurance Advocates, and a father who figured this out for his own son and then started helping the neighbors and now is working with 40 people to help other families. And so very wise on insurance questions and trying to help us find answers. So that'll be our next webcast. I'm thinking we might actually do a webcast on, given your background as a minister also, Tom, I'm thinking about those who are in congregations often turn to their minister, priest, or rabbi if they have a mental health question. And I wish we had a list of these organizations in like a sheet that every minister, rabbi, or priest could then hand out. I don't know how many of them are really trained well enough in this process. So, Tom, I think we're near the end. What a pleasure indeed to speak with you, to see you again. All that's missing is that table between us and a cup of coffee, lunch, and maybe sometime I can drop into Nashville and we can do that again. You're such a great person, Tom, and what you're doing. Blessings on you for all you're doing to help those who are very vulnerable. And we welcome the viewers to join us again on March 6th. That will be our next webcast. So anything else, Tom, before we close?
No, Virgil, I just want to thank you. I look forward to attending some of these as a listener. And I also want to thank Stephanie. She's the Wizard of Oz. She's the woman behind the curtain who makes all of this happen. And I'm grateful for her work on this too. So thank you both for this opportunity. And I just wish you to be well.
Well, thank you much, Tom. And tell you a secret, she's also my daughter. But don't tell them. No, people know that. I'm really proud to work with her. She grew up in the therapeutic communities that we spent most of our time in. So thank you too, Stephanie. And again, Tom, thank you. And thank you to the viewers. And if you have additional questions, please email them. Thank you for the questions that were submitted. So have a great afternoon where all of you are, and hopefully it's warming up. So we'll see. Thank you.
Thank you.